Greetings everyone and welcome to my channel. My name is Ewen Tembo. On this channel I plan to reflect on issues of public health and bringing faith and religion and see how faith or religion is able to influence public health. And many would argue that these two fields are so far apart. But in this series of brief videos, I want to be able to connect those dots between those two areas. And my aim is trying to establish that faith or religion interact with public health. And therefore, faith or religion is able to influence public health. And that's a journey we are embarking on. And I would want to invite you to join me on this exciting journey of having to explore this subject. And please just press that subscribe button. And also don't forget to press on the notification bell so that you'll be able to take notice when a video is uploaded on the same exciting subject. So please offer that support by subscribing and also pressing that bell. So we are there to explore and seek to connect the dots between faith or religion and public health. And in this initial video, I would start by having to look at what challenges really are in communities. And we establish what challenges are in communities as in terms of having to draw out one particular issue that causes everything else not to be able to function as it should. So I would initially have to give the example, and that is a familiar territory. So I'm giving the example of Africa. And when you look at studies in Africa, it shows that 41% of the population is poor. And I guess this figure might even be greater when we think about the issues that are coming with the pandemic. So it is there to show that Africa as a region has the highest poverty levels when you compare to other places on the globe. So poverty in Africa is one that is a big challenge. So we can draw out poverty as being a challenge. So in terms of what has come out, the status of the continent is like that. And this is attributed to slow economic growth, also weak institutions. We talk about conflict that comes up, also natural disasters, and also the inability of governments, authorities to implement programs that are there to reduce poverty. So you find those things happening and affecting communities. And when we track poverty through time, let's say we track poverty from 1990 to today, we find that there's an increase in poverty. And as Ellie alluded to, might even be worse because of the pandemic that we're going through. So poverty is a major problem as established, which in turn affect the effectiveness of national public health programs, and in turn affecting the local communities. So it is at this point that I look at this scenario as a scenario that needs serious intervention. And when I look at that serious intervention, it is an opportunity to seek partners. And especially when you look at low-income communities that are so affected. And the focus is really on low-income communities because that's where the challenges are. So we especially think of forming partnerships when we look at the shortfall that is there and that identified in national programs because they're not being able to be implemented to benefit everyone. So in considering partnerships, I want to bring in, for our reflection, to think about the role of faith and religion in influencing public health. So when we think about that issue, uh, then it should take us to another stage of having to explore local faith communities. So what I'm saying is faith or religion expressed in local faith congregations, local faith communities, uh, in various religions, and considering those communities as being able partners. So when I use the term local faith communities in this video and other videos to come, I'm really talking about churches, I'm talking about mosques, I'm talking about temples and their congregations. So I'm not using this term to focus on one particular group. Instead, I'm using these terms broadly as inclusive in terms of having to consider the various faith communities that we have in this world today. So the aim of this series is really to establish the role of faith and religion as practiced in local faith communities in improving health. So establishing the role of faith and religion practiced in local faith communities, right? And apply it in improving health. So we find that these communities that I'm talking about are communities that are part and parcel of communities. These faith groups exist in these communities where they serve their community. So here we are looking at how, when they are in communities, can contribute to the public health agenda. And when you are able to consider that they're part of that community, we are able to say that they are strategically placed to be able partners. So here we are looking at best practices, and also we'll be able to look at the harmful aspects as well. We try to be as balanced as we can. So join me in the next video as we consider to go on to look at an overview of the current trends when it comes to health in local communities, and especially in low-income communities. So thank you very much for watching, and I'll see you in the next video.